Chronic disease is something that many Alaskans are at risk of developing. And in 2022, they contributed to the top 2 causes of death in our state. The Alaska Department of Health has released a brief report on chronic disease in the last frontier, and Adrian Peterson breaks down the details of their findings in this week's Health Report.
Chronic disease is something that stays with patients for long periods and often never goes away. They are also among the most common health issues. In 2022, cancer and heart disease, both chronic illnesses, were the leading causes of death in the state, with other chronic conditions such as respiratory disease, liver disease, and diabetes rounding out the top 10 causes of death that year. Data from 2022 also shows that many Alaskans had chronic conditions, with high blood pressure impacting nearly 1/3 of the state's adult population. Many adults are at risk of developing chronic illness, however, with nearly 70% of adults in Alaska being overweight or obese, and over 80% of Alaska's adolescents failing to exercise for at least 1 hour per day. These conditions can be prevented, though. Healthy habits and lifestyles can play a big role in prevention, as exercise, healthy diets, and not smoking can all improve your personal health. Additionally, seeking preventative care can help identify these illnesses before or shortly after they develop. Nearly half of Alaska's senior population did not meet the colorectal cancer screening recommendations, and 40% of women over the age of 40 have not had a mammogram in the last 2 years, though. Both of these lapses potentially increasing the rate of death from cancer. This is Adrian Peterson reporting for News Center Fairbanks.
The Health Report is brought to you by Elevate Wellness Center.
While living a healthy lifestyle can help, not all illnesses can be avoided. Genetic traits and acute illness can impact anyone, potentially increasing their risk of chronic illness. There are also issues with obtaining health care services for some folks, as a lack of insurance and/or financial security can limit access to health care. Here in Alaska, living in remote areas can be a factor as well.